Well, good morning, everyone, and thank you also to the host for inviting me. Today I'm going to, I want to share basically three ideas with you. One is, which is my view on the current status of deployment of digital health and health tech in general. The second thing is, I would say, a strategy which for us is quite forward-thinking that we are trying to implement here in Catalonia, and it's this idea of the open platform in healthcare, and I will talk about that. And then maybe the last one is a call to action. So let me start by giving you some hints about my thinking on the current status of the deployment of digital health across the world. I think that I would like to start with a positive note. I mean, it's very good times to be working in health tech in general, and with this I'm including medtech, biotech, digital health, wellness. It's true that for all of us that have been working in this for many, many years, never we have seen as much adoption as it is now. Maybe we all know it's a shame that the pandemic was the accelerator for these things to happen, but the truth is that they are happening. Also, at the same time, we acknowledge or we recognize that both service providers, also technologists, it's not digitalization for the sake of digitalization, but we are trying to deploy and develop solutions that are meaningful and are adding value for both patients and our healthcare professionals. On a neutral side, these two notes on the neutral side is that I believe that investment continues to happen. There's a lot of investment right now. Possibly we have seen a shift of this investment towards more the biotech and the medtech because maybe digital health and wellness hasn't had this reimbursement pathways very clear, and we see a shift in there, but the good thing is that there's still a lot of investment. And then now we are a bit of, well, all of us, a bit steady and reluctant to see which will be the impact of the new regulations that you know that we have here in Europe, such as the European Health Data Space, the AI Act, or how this will end up impacting the medical device regulation and how these solutions will be able to come into the market. But at the same time, they are giving us a clear pathway towards how to introduce them, which I think it's also a good thing. And on a negative note, I believe that, and this is where I want to dig in a bit, we have two main problems. One problem for me continues to be the fact that we are an industry that continues to develop solutions as a standalone. We haven't been able to agree on how to develop these solutions in a way that they become plug and play across our ecosystem, as opposite to other industries that have successfully achieved to do such. And I will talk about this a bit later on. And our pending subject is scalability. I mean, we have, and you know that very well, we have many, many different pilots, successful pilots, but by many different reasons, we do not successfully achieve this big scale up of the solutions, and yeah, that's big failures also. So we need to be aware of that, and that's where I want to put the accent. So every other presentation right now needs to have a bit of AI, and that's my take on AI for this presentation. I see our ecosystem as a fortress, you know, and I try to prompt the AI to surround the castle with white coats, holding hands and protecting the castle. But I didn't succeed, so that's the best one that I was able to get from. Here you have the prompt, but it gives you a bit of the idea of my thinking in regards of this. And the truth is that the scientific literature is full of references to the scalability on how to scale up these solutions in real-life scenarios, or even to the non-scalability and which are the problems for scaling up these solutions. On your left side, you have a recent editorial in Frontiers in Digital Health, in which we have a very clear pathway towards the successful scalability of digital health projects. And as opposite to this, on the right-hand side of your screen, you have a framework which was developed by Professor Trisha Greenlack back in year 2017, which is a framework in the field of implementation science that analyzes the opposite, analyzes which is the factors that hinder the scalability and the further implementation of this type of solutions. It's complex interventions and it's tricky, and possibly the reasons that do not that hamper us from successful scalability of these solutions, it's possibly multifactorial. But I want to dig in a bit into one of them. I'm a technologist, you need to forgive me. And for me, one of the worst, and possibly the worst one, is the problem of data silos. And I want to stop here a bit and talk about this a bit. You know, we in Catalonia have been quite successful in the implementation of digital health technologies, also at a regional level, and we have connected all of our service provider organizations into a comprehensive EHR, and we are able to deploy many different solutions that are arriving to all of our citizens. And this is as opposite to most of the other countries in Europe. When we were writing our digital health strategy, we went to survey our different service provider organizations. And one of the things that we found out in there was the amount of data silos in which they store the data of the patients that they deal with. In a big tertiary hospital in Catalonia, we have in between 400 to 700 or 800 silos of information. And with this, I'm saying lab results, research files, pharmacy systems, all these different components that at the end conform the EMR, the EHR, plus many other different solutions, including medical devices. And the problem with all of these different silos of information is that when we try to have a comprehensive patient journey, it means a lot of integrations and it means a lot of interoperability. And you know, the current levels of interoperability, and that's my thinking on this, is that the current levels of interoperability that we have do not suffice in order to have or to deliver true person-centric care and longitudinal care pathways. All this data is stuck in all these different silos and is hampering the scalability of these solutions. In fact, all of you, the ones that are developing solutions and try to integrate them with Hospital A, when you try to move into Hospital B, it's always a problem and it means new integrations. When we are talking about all the spin-offs, startups, industry partners that develop solutions or data solutions, data products that have been trained on top of a specific data model, we have the problem that then when we move them into another setting, the performance of these algorithms, these data products, it's not the same and they need to be retrained. And we believe that something else is possible. And that's the second thing that I want to talk to you about. That's my second take. And this is the idea that we have in here related to the open platform. The idea of the open platform, and I want to raise your attention into this document, which is on your left side. It's a document that was initially written in year 2017 already by the Aperta Foundation in the UK. And it's a document in which these forward thinkers define how our industry could look like in the future in a way that it's more open and that follows the same pathway as other industries before us have followed. And it's related to agreeing on how to represent the major business concepts of our industry and when agreeing in between all of us, then ensuring that everyone can plug and play, so to say, their solutions in an easier way. What you have on the right-hand side is our take for Catalonia as a region, our systems architecture aimed at fulfilling this idea of the open platform. And let me use an example in regards of this, which is an analogy that I often use, which I think it will be more descriptive. So you have the guys from Google and the guys from Apple that they have these beautiful platforms, which is their mobile phones. And they developed iOS and they developed Android. And both of these platforms have open specifications for the market to be able to develop solutions and add value on top of their platforms. Well, basically, this is exactly the same idea. We want to have a platform. We want to have open specifications for you to be able to build solutions around that. But the difference with them is that what we will put in the middle, what we are putting in the middle, is the data from Catalonian citizens. So data of Catalonian citizens sits in the middle of the idea of the open platform, and we give you a set of open specifications for you to be able to build solutions in an open marketplace. And that's what we are building here in Catalonia, and that's our take on how to fulfill this idea of the open platform. I wanted to add this slide because I believe this is from EY, obviously, and I think it's quite explanatory of what I'm talking now about. So basically, on the left side, you have the current landscape, which is many, many, many different solutions, all of them with their own data models, their own business logic, which is completely buried in their systems. And then with some limited interoperability, it's an interoperability that some academics have accounted for, and it represents maybe 20% just of the information being understood when moving information in between these different systems. We try to have comprehensive patient journeys, and this is very patchy, really, really patchy. As opposite to the representation that you have on the right-hand side of your screen, which is, let's move towards, I'm not talking about a single database, I'm talking about a single way to represent clinical knowledge within the technical landscape. When you look into the banking industry, they have agreed on how to do so, and we can go with our credit card and get money wherever in the world. When we try to book a plane ticket, we can book from any airline. When we want to book a hotel, when we want to rent a car, all these different industries have managed to agree on how to represent their business concepts. Can we do that? If we do that, we will be able to have solutions built around this common data model, which will be plug and play across the ecosystem, and that's the main idea of it. So the benefits for this, for me, are very clear. I mean, data becomes more liquid, and when data is becoming more liquid, everyone is able to add value to this data. So either you are an academic, you are a researcher, you are a technology provider, everyone is able to look into this data. Obviously, here in Europe, citizens are the owners of this data, and therefore we need to have a lot of control over this. But then, well, we can give permission for research trials, for whatsoever to happen around this. When we are doing this, it's clear we are able to develop these solutions at scale, and we are able to add value across all of our citizenship. Right now, most of these pilots that do not scale up are only adding value partially to the population, at least in our region, and in a system which is national health system based, this is something that we cannot allow. So we believe that proceeding in this way, this thing will be better. So the last part is just a call to action. I mean, we know, we from the government, what we can do is define a clear strategy. It's published, it's available, it's out in there in English with our main ideas, and we need you. I mean, we need you, the ones who are producing technology, the ones who want to add value in our ecosystem. What we can do for you is publish the tenders, open these specifications for you to be able to consume them, and then establish very clear pathways on how to deal, well, for you, on how to interact with us, and very clear pathways towards the introduction of these solutions in the system. This is something that is in the process of being built. We are launching the tenders, and the idea is for this to be finalized anytime soon. With this, we believe that we will stop this fragmentation, that we will have more equitable healthcare services for all of our population, and at the end that this will be a benefit for all, and especially for the scalability of innovation. And this is as opposite to going towards the big monolithic solution, the big American system. When you have the big American vendor that deploys their solution, it kills the innovation in that ecosystem, And we believe that doing this with public money, that's not the way to go. We believe that this is really the way to go. I just want to end up by saying that the alternative, it's very clear. So this is where we are right now. And this is what we try to do every day, and that's our suffering on a daily basis. So this is something that we believe needs to change because we know where this leads to. Thank you.